Hi guys, Ben from Physio Professionals at Caloundra here with another video for you, and I want you to watch this so you can learn how you can screen at home for if you might have osteoarthritis and you should come in to see us. We've spoken about it already. Winter's coming, arthritis season is here. Elective surgeries have been put on hold and rescheduled, leaving lots of people in pain and suffering. Last week we spoke about what is arthritis and we learned a little bit about that, and today you're going to learn how you can check at home today. Have you possibly got it, and should you be coming in to see your professional physios here? So 3 things we're going to check off today. The first one, rehashing last week, your signs and symptoms. Do you have joint line pain? Pain in the joint, often worse at night, stiff in the morning, aggravated by movement and made worse with activity. Other signs and symptoms include swelling of the joint, redness and irritation around there as well. If you're ticking that, you should be moving on to the next step. The next step is I'm going to demonstrate a functional assessment. So this is a single leg standing followed by a quarter squat. I'll go and demonstrate this now. So standing here onto one leg, lifting your other one up, trying to balance, and then we're going to perform a small single leg squat and return. Do this test at home. If this is giving you pain in the ankle joint, in the knee joint, or in the hip joint, to me that's a possible sign that there could be signs of arthritis in there, combined with your signs and symptoms as spoken about earlier. The third thing we're going to check is what's called range of movement, or your ability for your joint to bend and straighten. We're going to look at 2 in particular, the knee and the hip, big culprits of arthritis. For the knee, we want to be able to see it fully bend and fully straighten without pain. So here's a quick assessment you can do at home on the bed. What you're going to do is come back on the bed here, bring your leg up on the bed as so. To straighten, your knee should be able to get flat down on the bed and your heel should even lift up just a touch. This is a full straightening or extension of the knee. The other one is a full bend. Can you bring that heel in towards your bottom? We want to see a full straighten or extension and a full bend of the knee, ideally without pain. Now, if you're saying, yes, this is giving me pain, that's the same pain that I get, there's your third sign, symptom test that you possibly might have that and you need to come in and see us. The next one I'm going to show you is for your hip. Your hip, we should be seeing flexion or your knee coming up to your chest past 115 degrees and a small amount of internal rotation. I'll demonstrate that for you now. Coming back on the bed, what we should be able to see is this knee here, we should be able to bring that up onto your chest, and our heel should be able to come out slightly out to the side. That test is looking at hip flexion coming up and internal rotation, and science has shown that if those 2 are reduced and you've got the pain on the functional test and the signs and symptoms earlier, that is a sign that there could be arthritis. What I want you to do, if you're ticking those boxes and saying, yep, that's me, give us a call, come in and see us. My name's Ben at Physio Professionals at Caloundra. Come in for your 10-point assessment where we can have a look today, give you the information that you need and get you on the pathway to reducing your pain and improving your quality of life, getting you back to the stuff that you actually want to do. Thanks for listening, guys.